we can test it out, right? So, I use a couple and you test it out. I always ask questions, specifically emergency medicine ones that, the answer to just I'm curious, right? And depending on them, I've definitely found the one that's specifically geared toward doctors does work fairly well, but it also tells you which journals are coming from. But again, right? So you have to know what you don't know. And then
Yeah.
the fear is that we don't really know what's in those black boxes. Like you can't actually ask just because you're an expert in one thing in medicine, let's say physicians, you can't ask them to be an expert in the technology behind AI and then ask them to take responsibility for it. Reminds me of a story. So I was in HIMSS EU, and so they asked the exact question. It was actually an emergency medicine question. A patient calls in, gets an AI answer for a set of symptoms. The AI tells them one thing, that they can sit at home, it's fine. Well, anyway, a couple days later, they're not fine. They go into the ER.